Participants are drawn from regional public health offices, ports of entry such as sea, air, and land, the security forces, among others, with the aim of detecting communicable diseases at points of entry and enables the health system to immediately respond to emergencies in communicable diseases. Dr. Okotubo, Director of Port Health Services, Federal Ministry of Health, Nigeria, dilated on the rationale of the program.
In 2021, the West Africa Health Organization organized a training and a training workshop for various countries in the sub-region, where we also had a harmonization of the point of entry curriculum, which is supposed to serve the entire West African sub-region. So this curriculum is for the points of entry. Points of entry means the land borders, the seaports, and the airports for the for the port health staff that work in all these regions. So after that training, participants were supposed to go to their various countries to cascade down to point of entry staff. Of course, the Gambia was also represented in that training, and so the West African Health Organization is facilitating that training for the Gambian point of entry here, and I was called to be part of the facilitators.
The Director of Public Health Services, Ministry of Health, Dr. Buba Manjang, spoke at length on the significance of the forum, saying the ministry is working tirelessly to strengthen all entry points for a zero disease in the country.
If you go to points of entry, you meet immigration officials there, customs, and other players, health officers. So, and these people work together. Let's say, for instance, travelers come, it's security that help the health officers to make sure the vehicle stops somewhere, the documentations are checked, and the health officers are the first point of contact. Why we do that is to make sure that all other staffs are protected, because health officers are trained such a way that they can handle people who come with suspected diseases of this nature. And then they also have some protective gears. We call it personal protective equipment. So they are protected first because their protection is of priority.
According to Dr. Manjang, Gambia is free from all forms of diseases.
Currently, we don't have any in the Gambia, but we continue on screening passengers as they come into the country. We screen travelers, looking for signs and symptoms of these diseases so that we can detect it early at the points of entry, and then we make sure that we do the right response.
Mohamed Lamin Chaiti, Permanent Secretary 1, Ministry of Health, described the training as vital for the health sector towards the prevention of diseases into the country.
Ministry of Health, our presence at the border is to monitor in the area of disease so that we can, control whatever foreign disease probably travelers might transmit or transfer to our country. It's very important, and it's a very, very important exercise that our public health officers are involved in.
The training is expected to enhance the knowledge of personnel at border entry points in addressing issues of communicable diseases. Ousman Baldeh, GRTS News.